Professor. Welcome to the program. Good to have you.
Yeah, good morning.
Yeah,
Thanks.
good morning.
Thanks for
Thank you.
having me.
Folks, I'm delighted to introduce Professor Joe Thomas. Joe Thomas is the head of the School of Global Health, and I'm Kevin Egan, the head of the School of Management. Now, Joe is with us today to have, if you will, share some of his insights and knowledge in relation to global health. So, Joe, thanks for joining with us today. Joe, if I can go through a couple of questions with you, or a couple of topic matters, probably a better way to put it. Joe, in terms of the world is really coming out of this global pandemic with COVID-19, what do you think has been the greatest impact, particularly when it comes to the developing world, from a positive and negative impact? What has been the greatest impact, do you think, regarding this pandemic?
Yeah, thank you for asking me that question because in today's context, any discussion about global health has to factor the impact of COVID and how we manage to deal with it and how we are planning to deal with the consequences of COVID pandemic. And one of my immediate observation is that the impact of COVID pandemic is differentially impacted on the countries, people, groups, and also the population. And that mostly depends upon their resources, their capability, and also their overall capacity. Some countries, they managed to cope with it. For example, Australia, you can say that relatively they came out of it, even though there are significant economic impact. But in some countries, it led to a series of, I would say that a series of impact on this. It's maybe a snowballing effect on that. For example, take the case of Sri Lanka. They go into a serious economic crisis is partially triggered by COVID pandemic. But in nutshell, I would say that COVID pandemic impacted the health inequity, or it is amplifying inequity in the health sector. I would say that's one of the major implications of the COVID pandemic.
Thank you, Joe. In relation to technology and the ever-changing technology that's happening both from a software and hardware, particularly across the developing world, what impact have you observed from a health sector across the world?
COVID pandemic may be the first time in the human history with the help of technology and science, we rapidly responded to an expanding pandemic. And particularly in referring to the vaccination. The vaccine, if you look at mRNA vaccination, so it was already in the pipeline for a different experimental level, but we managed to come out rapidly and to come out with a vaccine. And so logistically, we managed to spread almost all part of the world, but I'm not denying that there are significant vaccine inequities there. But from a science point of view, we managed to come out with from technology point of view, we managed to come out with a vaccine, and we tested the efficacy, and also we managed to implement it.
Okay.
So that's one of the major, the positive aspect of the COVID pandemic and its response.
Okay, thank you. Professor, you've worked in many parts of the world and dealt at various different levels of government and also business. Now, given the variation of political agendas, other influencing factors, geographical boundaries, what have you, when it comes to health issues, tell me about the pros and cons from a broad point of view, the global health issues currently.
In my view, health should be one of the major business of any government. But that idea of health as a critical element of politics somehow hasn't got the attention which it deserves. So COVID pandemic is a critical example of how we were not prepared to deal with one of the critical historical challenge of global health. So again, when I try to elaborate it, what I'm saying is that the concept of health, the way understood politically, that there is a lot of gaps, I would say that. It's not based on data, it's not based on evidence, it's mostly based on preconceived notions of what is health. So that's a major challenge, creating a consensus on the role of health in politics and the relationship between these two is the most critical issue of global health and public health.
Okay. And a sideline matter, if you will, with global health issues, transport and logistics. Now, in the developing, the OECD countries, we take transport and logistics fairly much for granted. However, this is not the case for a lot of developing countries. And so, from your experience and your knowledge, what have you observed about transport and logistics with it when it comes to health, whether it's transporting medical equipment or drugs or pharmaceuticals, whatever it is? What has been some of your observations and comments you'd like to?
From the health in general and from the global health and public health perspective, health logistics was taken for granted. But COVID pandemic brought the importance of looking at logistics very seriously. See, for example, when you talk about logistics, we have to think about the last mile connectivity to ensuring that vaccines, medicines, diagnostics are reaching at the last mile, the last person at the health system. And also globally, there's a consensus on leaving no one behind. To leave no one behind, we have to have a robust logistical system for health, for essential drugs, blood supply, and other materials. Even the supply of essential drugs is becoming an important aspect. And one positive thing is that now people are experimenting with the drone for supplying medicines at the remote areas. So there is one of the plus point in the context of a COVID pandemic. But the importance of logistics is brought forward because of the COVID pandemic.
I want to thank Professor for being with us today and going through some of these questions, and we'll look forward to the next program. Folks, thanks for listening, and we'll see you next time.
Thank you. Thank you for having me here.